Dr. Stuart Isaacson. He's a clinical associate professor of neurology at the Herbert Wytham College of Medicine. We're very happy to have him here today. He's talking about Parkinson's disease. It's more than motor symptoms.
Hi, everyone. I'm Dina Allen, and I'm with Acadia Pharmaceuticals. And so we're sponsoring the presentation today, and just so thankful that you had an opportunity to come and just learn more from Dr. Isaacson about things that you can talk to your doctor about and hopefully get some resolution. So thank you so much.
Parkinson Power Hour is welcoming you to this presentation today with Dr. Stuart Isaacson. He's a clinical associate professor of neurology at the Herbert Wytham College of Medicine.
Hi, I'm glad to be with you all here to talk a little bit about this non-motor problem of hallucinations and delusions that can occur in Parkinson's. What we're going to talk about a little bit here is about this problem that occurs in Parkinson's disease with some people, not everyone, but a lot of people during the 5 or 10 or 15 or 20 years of Parkinson's may have this funny thing happen where they can see something that's not there. And we're going to talk a bit about that. I'm Stuart Isaacson. I'm a director of the Parkinson's Disease Center here in Boca Raton, and Acadia Pharmaceuticals has a medication that they produce and market called Nuplazid, and we're going to talk about that one as well. They arranged for me to be here with you. And we'll talk a bit about non-motor symptoms, but predominantly the non-motor symptom of hallucinations and delusions, what it is, what are some symptoms, and really importantly, how to think or talk about it to your doctors and nurses. You know, we know Parkinson's disease is a very common problem. It causes tremor and slowness and stiffness, but not just these movement problems. It also causes non-movement problems, constipation, memory problems, anxiety, things like this. And one of these things that can occur is this problem of seeing things that aren't there. This idea of hallucinations where a tree looks like a person, or some people can see a little bugs or a child or a mouse or a dog. And some people can have delusions, which means seeing things that aren't true, feeling things that aren't true, feeling that someone might be out to get you or might have paranoia or think that something isn't going the way it should. So when we think about what could cause people to see things that aren't there or to believe things that aren't true, we know that it could be related to Parkinson's disease itself, because Parkinson's causes lots of different problems in the brain, not just in dopamine, the chemical that we aim to address with the dopamine medicines to treat the movement problems, but also in other chemicals. So it could be related to Parkinson's disease. Sometimes people who have impaired vision, or if you develop dehydration or a urinary infection, this can bring out the symptoms as well. And some medications we use to treat the bladder and some medicines that we use to treat Parkinson's movement problems can also precipitate some problems with hallucinations and delusions. This is what something might look like that's called an illusion, a type of hallucination. Here you can see that a sock that's just lying on the floor, someone might look at it and see a mouse. And this type of idea of seeing something that looks very different. And here we see a sock that looks like a mouse. There's not really a mouse, it's really a sock. It's just the brain playing a trick on someone. And these types of hallucinations can occur of seeing things that aren't there, of hearing things, of feeling things in the skin. All these can be different sensations that the brain can play a trick and make you think that is happening when it's really not. Here's a gentleman who sees a little girl and a dog next to him. That's a hallucination. It's not really there, but it's something that he sees, and he believes it's real because it seems real, even though it's not really there. The types of delusions that can occur include feeling that someone's not being faithful or trying to steal or trick someone, or watching or being watched. So if you feel like these are things that are occurring to you or your partner or your loved ones, let the doctors and nurses know, because it may just be the Parkinson's, and we can treat that or try to treat that. If someone's acting suspicious or feels that people are outside or watching, that's not a good feeling to have. So important to think about talking about it. Even when they're very mild, these seeing things that aren't there, or seeing a sock look like a mouse or a tree like a person, or feeling someone, even if it doesn't seem to cause any problems, be aware that they usually can get worse over time. And in one study, over 3 years, things got worse and had to be treated in some way to be addressed. So always want to talk, even if they're mild, to your doctors and nurses and let them know what you're feeling. We know that it's not just dementia or Alzheimer's, that just with Parkinson's disease, it can play a trick by making you see things or feel things that aren't true. Some people, when they have problems like an infection or they don't sleep well for a couple of days, it can bring them out. We still think it's due to Parkinson's and just brought out by other things. And they're not dreams. Dreams occur when you're asleep. These occur when you're awake. Now, about half of people with Parkinson's may have this at some point. It may just be when they're in the hospital after surgery or an infection, or it may be when they're home. And they can be mild, they can be once a week or once a month, or they can happen every day. But when they do happen, it's important to recognize that we now understand that it's probably related to Parkinson's disease, and not the dopamine chemical only that plays a major role in movement and can sometimes increase these problems, but also a chemical called serotonin. And serotonin, when it's overactive, can cause these hallucinations and delusions to come out, especially as the disease continues to progress over the years. We know that there's certain concerns about having these problems. Some people who have hallucinations and delusions wind up in the hospital more often or stay in the hospital longer. It can increase the need to go to assisted living and can increase the burden on caregivers and such. So it's important to recognize that this is a problem that we should be aware of, even if it's mild, so we can try to treat it when we need to. How do we treat it? Well, first we have to make sure that there's no infection and no dehydration. We have some non-drug therapies or cognitive therapies and behavioral therapies, and these can sometimes help. And then we have ways of trying to change the medications people take. Sometimes we avoid certain Parkinson's medications. And then we also can try to treat it with drugs. And we have a drug that's actually approved to treat Parkinson's related hallucinations and delusions. So even when they're mild, or if they're bothersome, it's important to have a plan with your doctors and your nurses and to talk to them about it. Most people don't talk about these. It may not be clear that when you see things that aren't there, that you would talk to your neurologist, nurse, or doctor about the problem of seeing things that aren't there. But you should, because it's part of Parkinson's. If you see things that aren't there, if you think that someone's acting strange, or you're feeling, or you think people are watching you, talk to your doctor and nurses, and they can ask you more questions to start the conversation and to be proactive with all your symptoms of Parkinson's, motor and non-motor, the tremors and the movement, the off episodes and dyskinesia, the walking and the balance, the driving and the sleeping, the constipation and the memory, all these non-motor symptoms, but also these hallucinations and or delusions. Describe if you see things or hear things or feel things that are happening, and try to keep a note of if they're happening once a month or once a week or once a day or multiple times in a day, because that can really be helpful to decide what the plan might be. Understanding and diagnosing and following it is very important, because then we can figure out how best to go about treating it. We know that it's common, these hallucinations and delusions, and we know that they can increase over time. So starting that conversation and letting your doctors and nurses know about it is important. So let's turn now to this medication called Nuplazid that was approved by the FDA a couple of years ago for the treatment of hallucinations and delusions that are associated with Parkinson's disease, psychosis. Psychosis is the word that means hallucinations and delusions. Like many medications, or like a lot of antipsychotics, Nuplazid has a warning, a boxed warning, that in people who don't have Parkinson's disease psychosis, who have dementia-related psychosis, there can be an increased risk of death in elderly patients who have dementia-related psychosis. But while it's not approved, Nuplazid, for treating dementia-related psychosis, that's not related to Parkinson's psychosis. So we're going to be talking about Parkinson's psychosis today. It's the only FDA-approved prescription treatment to treat Parkinson's psychosis, the hallucinations and delusions. It only comes in one dose, this 34 milligram capsule that's usually taken. There is a tablet, a smaller tablet, that's for people who need it for metabolism of other medicines and liver problems, but ordinarily this is the only dose that's commonly used. It doesn't work on dopamine. It works on the different chemical, this chemical serotonin, that we think is overactive. And when it's overactive serotonin, it causes these hallucinations and delusions. But this is a drug that quiets down the serotonin system. In the research program, we were able to see that it was effective in reducing the frequency. People had fewer or less severe hallucinations or delusions, and some had none. They all went away when they took the medication, even after 6 weeks. So we know that not everyone responds. Some people continue to have problems, and maybe this medicine won't work for them. But for most people, it works to reduce the frequency and or the severity of hallucinations and delusions. It begins to work as soon as 4 weeks, better than placebo. And we see the full effect up to 6 weeks. So important to recognize that. Most importantly, though, we found that when we use Nuplazid to treat hallucinations and delusions, it did not worsen the underlying movement problems. So it did not make Parkinson's worse, and it did not interact with Parkinson's medications, including not reacting with carbidopa-levodopa medicines. Like all medicines, side effects can occur. The most common side effects that were seen in the trial were nausea and swelling in the legs, sometimes the arms. Some people also had some other side effects that were a little more than placebo, feeling confused, hallucinations, constipation, walking, but you can see the percentages here compared to placebo. Other side effects could occur, so always if you have anything new that occurs when you take any medication, including Nuplazid, let your doctors and nurses know. If you're allergic to Nuplazid, you shouldn't take it. And for some people who have arrhythmias, funny heartbeats, they may have to be evaluated first to make sure that it's safe. But for most people, it would be safe. If you have any medications that you know affect how the liver enzymes work, let your doctors know, and always let your doctors and nurses know about all the medications and over-the-counter medicines included, vitamins and supplements, just to make sure there's no interaction with anything. This is what it looks like. It's not really this big. It's a 34 milligram capsule. It's taken once a day. Take it with or without food. Any time of day is really fine. To get it, you have to go get it through a special program that makes sure that it can get approved by your insurance and can help with the cost. And most people can get this medication, get access to the medication. And Acadia has a program called Acadia Connect. And this is a helpful program our patients have used to be able to get access to Nuplazid. So Nuplazid is a drug that was evaluated and found to be effective in reducing the frequency and the severeness of hallucinations and delusions without worsening Parkinson's movement problems and without interacting with any of the Parkinson's medications. It was approved by the FDA for treating Parkinson's psychosis. And I think the most common side effects we already reviewed. This is a video that I'm not sure is going to play. No, unfortunately, the videos aren't playing in this slide deck. Sure why. So I'm happy to answer any questions, though, and answer any questions on what you might have on Parkinson's psychosis or on any any questions you might have on Parkinson's. And if I can figure out the videos, find a place for it to work, I'll put them back on after the questions.
Dr. Isaacson, I have been diagnosed with having Parkinsonism, MSA and PSP. Does what you have to say about Parkinson's disease apply to me?
Well, so it's important to recognize that people who have slowness and stiffness and the symptoms of Parkinson's often have Parkinson's disease, but sometimes could have other disorders, including PSP or other disorders. And it's important to make an accurate diagnosis and make sure you get a second opinion to make sure it's the right diagnosis. Other disorders that are not Parkinson's disease do not usually respond well to the medications, levodopa, and sometimes have other problems. So important to know, there's also a lot of research going on, including research programs specific for these other Parkinson's conditions.
How long has it been available to the public?
This became available, I think, in 3 years ago, maybe 4 years ago. We've had our patients in different research programs here since 2008, but it became commercially available for everyone about 3 or 4 years ago.
How long does it take for this medication to take effect?
So we begin to see effect within 2 weeks, but we see an effect that's more than placebo in 4 weeks, and we see the full effect by 6 weeks. So usually we want to give it a good month or two, usually a 2-month trial to really see the full effects.
Does it have a negative effect at all when they're taking the carbidopa levodopa or the Cinemet?
It does not interfere with the carbidopa levodopa, and importantly, it's one of only 3 antipsychotics that have been found not to worsen Parkinson's movement problems. The other one requiring a weekly blood test, and the third one not having been well studied, and not so we don't really, it's not approved. Nothing else is approved for Parkinson's psychosis except for Nuplazid.
Doc, how do these work differently than other atypical antipsychotics?
So all atypical antipsychotics block not only serotonin, but also dopamine. And in doing so, can worsen Parkinson's movement problems, and for that reason should not be used. The only 3 antipsychotics that are atypical that can be used and not worsen Parkinson's movement problems are quetiapine, which is not approved and hasn't been well studied, but is sometimes used. Clozapine, which is not approved, but for Parkinson's psychosis and needs a weekly blood test because it could affect the blood count, and Nuplazid. So only those 3 antipsychotics do not worsen movement problems. All other ones can and need to be avoided for most people.
We do have a service called Acadia Connect that can really help to make Nuplazid affordable. As a matter of fact, 80% of patients actually pay less than $10 for their Nuplazid. So there's all kinds of programs available, copay assistance cards. And so we will do whatever we can to make this product affordable for you if you and your doctor decide this is the best option.
I have one more question that a friend texted me. She was unable to make the presentation today, but she is a woman living with PD that her non-motor symptoms, Dr. Isaacson, are specifically that she is constipated all the time, but she also feels as though she has to go to the bathroom even when she doesn't have to go. So she was wondering if there was any advice that you could give on that particular non-motor symptom.
Well, we think Parkinson's disease may begin in the gut with slower movements, with constipation and all, and certainly throughout Parkinson's, the constipation, it could be a big problem and has to be addressed. It's not just the gut, the colon, it's also the esophagus can be slow, and people may feel there's food or medicine stuck in the chest, and the stomach can be slow and make medications for Parkinson's delayed in their onset. The constipation itself should be evaluated. If you haven't had a colonoscopy recently, often a colonoscopy should be done if you haven't had one in 5 years to make sure that that's clear and there's no polyps or anything. And then the constipation can be treated. Walking helps, hydration helps, and then medications that can help the stool move along, like Miralax, and stool softeners that can make it easier to pass the stool, like Docusate, can be helpful. Sometimes the neurologist, your internist, can help with these, and many of our patients take both the Miralax and the stool softener and then find what keeps them regular and do it regularly. Dietary changes can help. Mangoes can help constipation. So if you like mangoes, a mango a day can keep the constipation away, as they say. And also a cocktail that was developed some years ago called the Rancho Mirage cocktail, where you can mix together a cup of applesauce, a cup of fine Miller's brand, and a cup of prune juice, and mix it all together and take a tablespoon or 2 a day, and that can help as well. And then there's some research programs going on looking at new treatments for constipation in people with Parkinson's. If you're still having constipation, seeing a GI specialist might be in order as well.
You mentioned gut health. Is there something, because we hear a lot about what goes on, in the microbiome in the gut can also affect people. Is there a blanket thing that you could recommend that people could take for just to promote healthy gut health?
Unfortunately, we don't know that. We don't know if we can change the biome effectively for helping the gut be more healthy, or in Parkinson's specifically, know what that would be. Some people use these probiotics, but they're not standardized. And we don't really characterize well yet the biome in Parkinson's or even without Parkinson's. So we don't really have good answers for that other than trying to treat the constipation so the gut moves better and to try to have a healthy diet. So we don't really have knowledge that probiotics are useful in Parkinson's. We don't know that right now.
What about the time of day, or is there an optimal time when someone should take their medication? Should they eat right before, 20 minutes before, after certain foods?
So there's a lot of interest in talking about when you take your levodopa, should you take it before food, during food, after food, an hour before or after food? And sometimes there's stickers on the bottle that tell you to do this. Sometimes there's multiple stickers that tell you to do the opposite in the stickers. I think for most people, it really doesn't matter whether you take your carbidopa, levodopa with food or without food. For some people, maybe around 10 or 15% of people, when they take their carbidopa, levodopa with food that has a lot of protein, it can prevent it from working as effectively. But for most people, it doesn't make a difference. So if you notice that if you have a tuna fish sandwich or a steak and your carbidopa, levodopa doesn't work so well, let your doctors and nurses know, and they could advise you to separate some pills from meals. Some people find that if they take the pills on an empty stomach, they don't work as quickly, and they need some food in the stomach to get the stomach to empty the medicine so it can be absorbed. So it can be complicated. I tell my patients that for most people, it doesn't make any difference whether you take the pills with or without food, just to let me know if they're having a problem when they take it with certain foods. Also, with the long-acting carbidopa, levodopas that are available and the new ones that we're studying, there's always levodopa in the gut and bloodstream, so you cannot really separate it from food or protein.
All right, Dr. Isaacson, one of our members would like to know about bowel incontinence. Very soft stool, not diarrhea, but very soft. And often they don't know when they have to go to the bathroom.
Well, it can be a very troublesome problem when stool can leak out overnight or when you're not aware of it during the day. And this really will require trying to bulk up the stool and slow it down, sometimes requiring medications like Imodiums and such. And really, I think requires a gastroenterologist, a GI specialist, to help guide how to bulk up the stool to try to reduce that problem, which can be a terrible problem and lead to other infections and irritations.
One of our members has very vivid dreams, and they would like to know when or if this can become a hallucination.
So the vivid dreams can occur frequently in Parkinson's, and we particularly want to make sure that we recognize that some dreams that people can act out, punching and kicking and running and jumping out of bed in their dreams, and these can be dangerous. They can hurt someone else in bed. They can cause injury if you fall out of bed, and we can treat that effectively. That condition is called REM sleep behavior disorder. And with a low dose of a medicine called clonazepam, it often goes away fully, allowing people to get more restful sleep. So that's one issue. Second, some people who have these vivid dreams may be more likely to develop hallucinations. So if you have these things that occur when you're awake, I'll let your doctors and nurses know as well.
Right. One of our members asked about exhaustion that happens after taking Sinemet.
It's important to know that Sinemet has a lot of good effects, but some people may feel queasy or nauseous, or feel dizzy or lightheaded, or feel tired after taking certain doses. Sometimes it can be because the dose is too low. Sometimes it can be because the dose is too high. And it's important to make sure that it's not lowering the blood pressure. So if you're having this problem, try checking the blood pressure with the machine half an hour after taking a dose, and make sure it's not too low when you're sitting down. And then talk to your doctors and nurses to see if it needs to be adjusted, the dose to see if you don't have that symptom.
Please repeat the Rancho Mirage cocktail because they only got the part about applesauce and prune juice.
1 cup of applesauce, 1 cup of prune juice, 1 cup of fine Miller's brand.
Yes, could you talk about the daily time span? I have my biggest problems in the morning, but by nightfall, I feel good. I don't understand it.
Well, everyone has good times and bad times of the day, and people with Parkinson's are no different. Part of it reflects their circadian rhythms. Some reflects how restful you are during the day, during the nighttime when you sleep, how restful sleep is and how refreshed you are in the morning. Some reflects activity during the day and how much exercise and activities. Some reflects medications and hydration, and both Parkinson's medications and other medications. Some reflects blood pressure. Blood pressure is low, you might feel fatigued and exhausted, and when it's better. People with Parkinson's have lower blood pressure earlier in the day and it rises as the day goes on. So some people who have problems when they're don't feel good in the morning but feel better later in the day should make sure their blood pressure is not too low earlier in the day, and to make sure that they're not having any sleep disorders overnight that prevent them from getting restful sleep. Those are a couple of tips to discuss with your doctors and nurses. So memory can sometimes be affected in Parkinson's. It can be affected in aging as well, and can be affected by medications. And it can be affected by vitamin B12 and thyroid. So make sure you talk to your doctors and nurses and they check a vitamin B12 and a thyroid blood test. Make sure they review all your medicines. You can bring your bottles in to make sure there's no medicine that's affecting your memory. And then be aware that there's some medicines that have been approved by the FDA to treat memory and Parkinson's. The one is called rivastigmine that can come in a pill or a patch. And there's some others that can be used as well off label. We're also actively investigating to try and find medications that can prevent memory problems in Parkinson's or treat them in Parkinson's. There's a couple of research programs that we're doing trying to find new treatments for memory and Parkinson's. So a lot of things to talk to your doctors and nurses about.
We'd like to thank you guys also for taking time out of your busy day. We'd like to thank Dr. Stuart Isaacson for coming in and giving a wonderful presentation, and also Dina Allen with Acadia Pharmaceuticals, because they made this presentation possible today. So thank you, everybody. Have a wonderful day, and we'll see you next time at Parkinson Place.